Tell me who you are and what do you do?
I'm Dr. Rami Apellian. I'm an epilepsy specialist here locally in Southern California. I specialize in patients who are adults and epilepsy in the elderly.
So why is it really important to talk about epilepsy and bring it out of the shadows?
For years, epilepsy has been stigmatized. Children with seizures are thought to have a disabling illness, and it's the wrong approach to identifying and educating our patients. Particularly my patients who are developing epilepsy later in life. As an adult epilepsy specialist and one who is interested in treating patients who are above the age of 65 with epilepsy, increasing awareness that epilepsy even exists in this patient population is a very important mission that we must embark on in order to ensure that the patients are aware and the doctors are aware and the treatments that are available to the patients are actually getting in the hands of the patients.
Now, I'm an adult with epilepsy, and I've been through several tests and also trying various medications. And what I found is the stigma about talking about it to other people. Is that something that you talk about when you're talking to your own patients?
It is a challenge. A lot of my patients have lived a very successful, full life, never had a seizure. Then after some sort of an injury, whether it's a fall or a small stroke, the patient develops epilepsy. And these are patients who never thought that they would have epilepsy. So it is important to ensure that when we're educating our patients who in the past thought that they were not the patient who would develop this disease, that they do dissociate from the stigma, because they are going to be the advocates to their community, that they are going to be the people who go out and show the world that epilepsy is not disabling. Epilepsy is not something to be afraid of. In fact, the more honest we are and the more honest the discussions we have about it, the more likely we are to overcome any of the stigma associated with the disease.
So tell me about your talk here at Epilepsy Awareness Day.
Yeah.
What's the subject?
So I'm speaking about epilepsy in the elderly. The purpose of my talk is really just to increase awareness among the community that epilepsy is a disease that can develop later in life, not just in the pediatric population. The incidence of epilepsy is actually highest in patients above the age of 75. So as patients get older and as life expectancy increases, more and more patients are going to be at risk for developing epilepsy, and it's important that we identify that early in order to increase awareness, to reduce ER visits, and improve access to care.
So how do you identify people in the older population with epilepsy?
That's a very challenging task. Unlike children, adults, particularly those who are older, tend to be living independently. They're not monitored 100% of the time. Sometimes they may have spells that they're not sure what's going on and they don't think that it is actually a seizure. So it's important to actually educate the patients, but also their primary care physicians, the frontline doctors, that anytime somebody has recurrent events that are classic and easily described, that are recurrent, these are the things that we have to look out for in order to identify epilepsy in an adult population.
And finally, why is it really important for people to come to Epilepsy Awareness Day?
Having an opportunity to spread a wealth of information to the community that's free increases education, it increases access, it increases awareness. There's a number of vendors and educators here that really want to tell patients and tell the world their story. And I think until we actually are able to have that open dialogue, we're not going to be able to get past that barrier and that stigma. And events like this, really everybody coming together and sharing their experiences, sharing what they can contribute to each other's life and education, really is a great way to get the community involved.
So thank you very much.
Thank you very much.
And have a really great day.
Thank you.
Have a great talk.
Appreciate it. Thank you so much.
Nice.